Good day. Welcome to REPSI's presentation on stigma and discrimination during COVID-19.
I'm a young lady who is looking forward to writing my final high school examinations this year. I had hoped for a bright future. With my family and friends behind me, nothing was going to stop me from succeeding, so I thought. This perspective suddenly changed when I was diagnosed positive for COVID-19. Two of my siblings and my father was also tested positive. Fortunately, my mother and brother tested negative, and they have been looking after us. We have not been that fortunate with some of our neighbours, friends and relatives who are now shunning us and giving us derogatory names. My mother and brother are now finding it hard to go out to look for food and other things that we need, as people avoid them and some actually threaten to beat them up. To make matters worse, I now worry whether my fellow students will accept me back at school. I am also worried that both my parents might lose their jobs, the only source of income we have. Will the public accept us after this pandemic is over?
Sadly, this is becoming too common a reality in our society. As the COVID-19 pandemic cases continue to rise, we are now witnessing a lot of stigma and discrimination building up against anyone with the disease or suspected of having it in their family members. Cross-border truck drivers, frontline workers including emergency responders or healthcare professionals, people who have recovered and released from healthcare centers or COVID-19 quarantine centers, migrants and refugees, those who have traveled to heavily affected regions, and older people. The World Health Organization highlighted that COVID-19 related stigma and discrimination is mainly caused by the disease is new and much is not known about it, especially how it can be cured or controlled. Fear of the unknown. It is easy to associate that fear with others, lack of information or misinformation. Stigma and discrimination include social isolation, propagation of myths, acts of violence, and blaming which affects an individual's self-worth, hinder correct information sharing, and the quality of care. Those that experience stigma may feel hopeless. They need support and help. Unfortunately, stigma and discrimination undermines efforts at testing and treating the disease. It affects the emotional or mental health of people who are affected and discourages them from practicing healthy and helpful behaviors. This makes it harder to manage and control the spread of the disease. Stigma and discrimination can continue even the pandemic has been contained. Although there is so much that we don't know, we can continue to share correct information about the things that are known. Recommendations to governments. Share messages about the pandemic, prevention of spread and management of illness. Guidelines and standards on response to COVID-19 must include a focus on understanding and addressing social stigma and discrimination experienced by different populations and professionals. Promote and adopt family-centered approaches that build on community strengths and social networks to stop stigma and discrimination. Allocate resources for community responses that integrate care and support, including for those that have experienced stigma. Engage the media to provide positive information and advocate for non-discrimination. What can we do together? We have to work together to defeat COVID-19, and it starts with you and me. Assure persons in isolation and quarantine that they are not being stigmatized. Give psychosocial support to people who have tested positive, their contacts, frontline workers, and those facing stigma and discrimination. Share accurate information about COVID-19 with others in your community that is not stigmatizing or discriminatory. Respect and support those seeking healthcare and who may be part of any contact investigation. Speak out against stigma and discrimination. Share positive stories which bring hope. We are stronger together. For more information, visit our website and social media platforms. Alternatively, you can write to us at info@repsi.org. Thank you.